The format of the meeting is a yes or no, and as usually happens in medical research, you never had a black and white answer. I would say that it's too early to say, and in particular, there are two different diagnoses in autoimmune diseases. We have an early experience in some diseases, in particular with lupus, in which CAR-T had provided excellent results, and they have to be confirmed for sure. But then there are other diseases, and in particular multiple sclerosis and scleroderma, in which transplantation has provided excellent results, and in particular in terms of long-term remission. So considering that the pathogenesis of this disease is very complex, possibly more complex than lupus, I would recommend more prudence in that. So unless we don't provide new data, I mean pilot studies indicating that CAR-T could be a good option in these diseases, I would postpone any clinical trial in that, unless there are patients, good candidates for transplantation, but due to comorbidities, they cannot proceed to the transplant. In that case, we could try with the CAR-T. So I would say it's too early to say, but there is a room for sure for confirm the existing data on CAR-T for autoimmune disease and make some exploratory trial for other diseases.